Assalamu alaikum. Hope you are all doing well. In this video today I will be discussing about medical asepsis or medical hand washing or performing hand hygiene. Let us first discuss the key learnings what we are going to learn in this video. So first of all we will start with the introduction followed by definition. Then let us see that for whom it is important to go for hand hygiene. Then why should we and when should we perform hand hygiene, and then what are the various steps of medical hand washing. Let us start with the introduction first. As all of you know that thousands of people they die every day around the world because of infections, and these infections are those which they occur while they are receiving the health care. So it means that patients who are admitted in the ward they die because of the infection which they acquire from the hospitals, not from the disease for which they have been admitted. And in this way, the main source of infection or main source of transmission of infection is through hands, because they are the main pathways of germs, and the hands they transmit infection from patient to the caregiver, or from caregiver to the patient, or from one patient to another patient. So that's why hand hygiene is therefore the most important measure to avoid the transmission of harmful germs and prevent healthcare associated infections. Now let us see what is the definition of hand washing or hand hygiene. So hand washing can be defined as a way of cleaning one's hands, but cleaning in such a way that substantially reduces potential pathogens, which are harmful microorganisms present on the hands. So hand washing is a technique which we use to clean our hand in such a way that the potential pathogens or microorganisms which are present on our hands are made free from those in order to prevent the transmission of infection. So now let us see who should go for hand washing. So any healthcare worker working in the patient care settings, be it in the hospital or any clinic, they should definitely go for hand washing. And those who are providing directly care to the patient, which can be the healthcare providers or can be the attendants of the patients, those persons who are involved in indirect and direct patient care, and they need to be concerned about hand hygiene, and they should be able to perform it correctly and at the right time. Now the question which may arise in your mind will be, when should we wash our hands or perform hand hygiene? There are basically the 5 moments of hand hygiene for healthcare workers, which can be even before touching a patient one should go for hand washing, before doing any a clean or aseptic procedure, and after bodily fluid exposure risk, after touching a patient, and after touching patient surroundings. And these are the 5 moments when a person should go for definitely go for hand washing. So let us see why should we go for hand washing before touching a patient, because we want to protect the patient against colonization and in some cases against exogenous infections which are carried on the hands of the caregiver. So before touching a patient we should go for hand washing. So when, that is, clean your hands before touching a patient or approaching him or her. Then there are some situations when this moment one applies, which include before shaking hands, before assisting a patient in personal care activity, before delivering care and other non-invasive treatment, for example applying oxygen mask, giving a massage, and before doing anything, before touching a patient, then we have to go for hand washing. So again, which second step will be before doing a procedure. Why? To protect the patient against infection with harmful germs, including his own germs which may enter his body. And clean your hands immediately before assessing a critical site with infectious risk for the patient, for example, non-intact skin or an invasive medical device such as a catheter. So situations when this movement applies will be before any vaginal or rectal examination, or examining mouth, nose, air with or without an instrument, doing suctioning, before wound dressing, before inserting an invasive medical device like cannula, nasogastric tube, endotracheal tube. And these are the situations where we should go for hand washing before doing that procedure. So after body fluid exposure, we should go for hand washing, because to protect a caregiver from infection which may get transmitted from the patient to that care provider. And when should we do that? We should immediately clean our hands after completing the task, or after immediately having an exposure to body fluid. And the situation where this movement applies is when the contact with the mucous membrane and with non-intact skin ends, after inserting an invasive medical device, after removing an invasive medical device, after removing any form of material offering protection such as napkin, dressing, gauze, etc. Then after touching a patient, it is important to go for hand washing, because to protect you from patient germs and also to protect healthcare environment from germ spread. And when we should go for is that we should clean our hands when leaving the patient's side and after having touched the patient. And the situation when this movement 4 applies is after shaking hands, stroking a child's forehead, after delivering care and other invasive treatment, changing bed linen as the patient is in, then applying oxygen mask, giving a massage. These are some of the situations where we have to go for hand washing immediately after touching a patient. And again, wash hands after touching patient surroundings. Again, this will help to protect the healthcare providers from getting the infection which may be present on the surfaces or in the patient care surroundings, and also this will help to protect the healthcare environment. So we when this applies is clean your hands after touching any object or furniture when leaving the patient's surroundings without having touched the patient. So even though you have not touched the patient but you have touched his surroundings, in that way also you have to touch the patient. Surroundings may include the bed, bedside table, all the equipments used by the patient. And this movement applies in following situation like after an activity involving physical contact with the patient's immediate environment, for example changing bed linen with the patient out of the bed, holding a bed trial, clearing a bedside table, or after a care activity, for example after adjusting perfusion speed, clearing a monitoring alarm. In all these situations one has to go for hand washing. Now let us see how to perform hand hygiene. So there are two methods of medical hand washing, which one include hand rub and another will be hand wash. Hand rub is when you are cleaning your hands by rubbing them with an alcohol based formulation. As this is the preferred mean for routine hygienic hand asepsis if hands are not visibly soiled. मतलब अगर आपके हाथ गंदे नहीं लग रहे हैं या कोई ब्लड वगैरह या कोई म्यूकस नहीं लगा है, in that way it is not necessary for you to go for hand washing. You can just go for hand rub because it is faster, more effective and better tolerated by your hands than washing with soap and water. So we should use alcohol based hand rub. And other means is the hand washing. Wash your hands with soap and water when hands are visibly dirty or visibly soiled with blood or other body fluids, or after using the toilet. So it is important after using the toilet you should not use hand rub, you should go for hand washing. And once your hands are visibly dirty, आपके हाथों पे लग गया है blood, mucus लग गया है, in that case you cannot use the hand rub, you have to go for hand washing with soap and water. Now, let us see first that steps of doing hand rub, and then we will be discussing about steps of hand washing. So now let's go through the steps of hand rub. These include many steps. Starting with the first step will be, and before starting the steps, let me say that duration of the entire procedure should be 20 to 30 seconds. So how you can go for a hand rub is you have to apply a palm full of the product in the cupped hand. तो सबसे पहले हम जो स्प्रिट है अल्कोहल बेस्ड हैंड रब है उसको अपने हाथ पे लेंगे और उतना लेना है कि जितना दोनों हाथ को कवर कर सके. Then we have to rub hands with each other, that is palm to palm rubbing. Then then after that go for palm to dorsum. Place palm of one hand on the dorsum of the other hand, and then vice versa. Do the same with the other hand. Then the next step will be palm to palm with fingers interlaced. Then back of the fingers to opposing palms, or we may say that washing of the knuckles. Then rotational rubbing of left thumb. Then doing same with the right thumb. Then rotational rubbing of the backwards and forwards with a clasped finger. That means rubbing fingertips with the palm of the other hand, and then doing same with the other hand. And then once hands are dry, their hands will be considered safe and clean. So these were the steps of hand rub. Now let us go through the steps of medical hand washing. So the steps of both the hand rub and the medical hand washing are same, but there is a one difference, that in case of hand rub we use alcohol based solution, and in case of hand washing we use soap and water. So now it's a good idea to remove jewelry before washing your hands. Before going for the hand wash, you should always try to remove your jewelry, and you should wash your hands for the amount of time it takes to sing happy birthday twice. So जितना टाइम आपको हैप्पी बर्थडे बोलने में लगेगा, 2 बार हैप्पी बर्थडे बोलने में लगेगा, लाइक हैप्पी बर्थडे, that may be around 40 to 60 seconds in total. So this much of time you have to take for hand washing. So you require less time for hand rub, and even you require more time for hand washing. So before actually starting the hand washing procedure, what should we do? We should always remove jewelry before hand washing. Then you should wash your hands for the amount of time it takes to sing happy birthday twice, around 40 to 60 seconds in total. Then wet your hands with water, and then apply enough soap to cover your hands. So the step 1 will be rubbing palm to palm. So in this method we have to rub our hands together. This is the first step. After applying soap on wetted hands, we have to rub palm to palm. You can see in the picture, and rub these palms together. Now the step second is palm to dorsum. You have to place palm of one hand on the dorsum of the other hand. That means you have to use one hand to rub the back of the other hand, and clean in between fingers as well, and do the same with the other hand. So you can see in the picture. The third step is interlocking of the fingers. So in this way we have to rub palm to palm, and then we have to rub our hands in between, and we have to clean in between your fingers as well. This is the third. The step 4 will be washing of the knuckles. So grip the fingers of each hand together with the back of your fingers against the palms of your other hand, and rub your fingertips together, and rub the back of your fingers against your palms. दोनों हैंड्स को ऐसे पकड़ना है कि उंगलियों को एक दूसरे के साथ जैसे लॉक करना है, फिर दोनों को सर्कुलर मोशन में रब करना है. Then step 5 is washing of thumbs. In this method you have to rub one thumb using your other hand and do the same with the other thumb. The sixth step will be washing the fingertips. So in this case we have to rub the tips of your fingers on palm of your other hand, and you have to do same with your other hand. So राइट हैंड के टिप्स से लेफ्ट हैंड के पाम पे रब करना है एंड देन लेफ्ट हैंड के टिप से राइट हैंड के पाम पे रब करना है. Then the last step will be clean your wrists. So we have to clean both of your wrists by rubbing with opposite hand in circular motions. Then after completely doing the 7th step, you have to rinse your hands with water and then dry your hands completely with a disposable towel. With a clean disposable towel. And then you have to use the same clean disposable towel or napkin to turn off the tap. That means after completely doing the procedure you cannot touch the tap, otherwise your hands will again get contaminated. So now let us summarize. Since washing your hands is one of the easiest way to protect yourself and others from illnesses such as food poisoning, and also protects from the spread of infection through viruses such as flu and coronavirus. So one should go for hand washing and follow all the steps and do it for completely 40 to 60 seconds if it is hand washing, and do it for 20 to 40 seconds if it is hand rub. So this was all about performing hand hygiene or medical hand washing. If you have any queries or you want to give any feedback, do comment me in the comment section, and if you like the videos then share and subscribe. Thank you.